Welcome to the Darcy Wellness Show. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic. Today's show is on allergies, and joining me in the studio today is Dr. Arthur Gertlet, medical doctor at the Darcy Wellness Clinic, Terry Plant, acupuncturist, pharmacist, and certified NATE practitioner, and on my left is Leslie Barnett, certified nutritionist. Thank you all for joining me today on our talk about allergies. So, Dr. Gertlet, allergies run the whole gambit here of being gastrointestinal, seasonal, hay fevers, they can trigger all kinds of things. So you've been a gastroenterologist for too long, a long time, many decades we can say. So you must have seen really severe. How severe can food allergies get, say, clinically?
Well, we think that food allergies are strongly implicated in a lot of gastrointestinal diseases, and they can result in the need for surgery, scarring in ulcerative colitis, Crohn's disease, stomach disorders. They can get very severe.
So it's a kind of chronic, ongoing irritation, inflammation that over many years can actually lead to scarring tissue and causing colitis.
Yeah. Of course, there are many, many other things that allergies are related to, involved with also, many other diseases.
Yeah. So if we could go to our next slide, basically it's a severe problem in the U.S. I mean, there are millions of people suffering. 50 million people suffer from allergies in the U.S. And this is an amazing one too to me, the fifth leading cause of chronic disease of all ages. So Terry, as an acupuncturist, and you specialize in a form of acupuncture that treats allergies. Across the gambit of seasonal allergies and gastrointestinal allergies, what kind of success rate do you think that you get with patients?
With the NATE protocol, I get about 80% success rate.
That's pretty phenomenal.
Yeah, and. But as a pharmacist, it's truly amazing when you say that all ages, it really begins. A lot of children get it even as immediate as they're born. They have difficulty taking in breast milk. And as a pharmacist, I see it all the time where there's constantly prescriptions for the need of formulas for children, very young to, older, of course. But It, as a pharmacist, it amazes me that it's that young.
Yeah.
As an acupuncturist, I see it all the time as well, where there's infants that come in that need to be treated for breast milk or anything like that, which causes, from the immediate noticeable pronounced symptoms, would be any difficulty breathing, to skin allergies, and that's the most pronounced that parents can see. But as you get older, parents also see it in their children as they get older. Typically, I see a lot of children around 10 years old, 12 years old, where cognitively things are changing. School teachers are noticing it, parents are noticing it.
And more common too, right? I mean, I was reading that around hay fever in the around 1750 in England, somebody did a poll in rural England. A doctor there did a poll to see how many people had hay fever, and it was practically zero. Mm-hmm. And then they did it 50 years later, and they've done it since then, and it's now gone crazy. So the idea of within 2.5 centuries, we've gotten to such literally a fever pitch of respiratory allergies and gastrointestinal allergies that it's very scary. If we could go to our next slide, the idea of how many ways that allergies can impact us. So we can see that seasonal hay fever, ADD, ADHD, attention deficit disorder. You're looking at arthritis, even an allergic component for arthritis, asthma. Autism may have some impact from allergies, digestive issues, eczema, chronic fatigue, different emotional problems, fibromyalgia, irritable bowel syndrome. We're looking at headaches, migraines, stress, and many more. So, Dr. Gertlet, these are very complex symptom patterns. It seems like there's an epidemic going on right now.
Yeah, it's good statistics show that if you include food allergies, the gastrointestinal allergies, in allergic conditions, the majority of Americans have allergies, especially in this country. And every one of those conditions is very, very important to test for food. And I would say of the single thing that we do in treating all of those conditions, the single most important thing, is Terry and Leslie indicated, is get them off the offending food allergen.
Right. So how does food allergies create such havoc through such a wide variety of symptoms? What's the mechanism there?
The food allergies are thought to be related to improper functioning of the gut. The membranes are too porous, related to poor diet. They get damaged, but in a very microscopic way, and they allow things into the circulation through the gastrointestinal tract.
So that would be the kind of the idea of linking in food allergies to arthritis, let's say.
Right.
You know, the idea that leaky gut, partially digested food particles ending up in joints being attacked by the body for being foreign invaders, basically.
Right.
So what about ADHD and some of the emotional component with food allergies?
Well, all of these things cause what's called an autoimmune component to these. They activate the immune system. These things getting in from the GI tract are foreign. They stimulate an immune response, and this leads to chronic inflammation, and depending on the genetics and what food it is, can affect the brain, almost any organ. The skin is very, very common, eczema, psoriasis, but brain function is also very important. Literally, no organ is spared.
So in the connection with autism, the idea that it can aggravate autism? Or?
Oh, yes. Leaky gut and overgrowth of the wrong bacteria is a very common thing in autism, and it's felt to be a very big part of the disease. It can also be translated in utero during birth. In the placenta, can cross the placenta, and that's why, as Terry had indicated, early childhood, infancy, some of these children develop this.
So the idea is that there's leaky gut, food particles are leaked across from the small intestine into the bloodstream, and then can be distributed anywhere in the body and be attacked by the body as being foreign invaders, is central to the connection with IBS, with fibromyalgia. That kind of mechanism is involved in the autoimmune response to it.
Yes.
Yeah.
And we can check individual food allergies with specific tests.
So if we could go to our next slide, why are allergies more common now than that first survey in rural England in 1750, where they were hardly known? What are some of the factors? So it's believed that, the industrial chemical age, the idea of between 80 and 100,000 new chemicals being in the environment, unknown, that weren't there in 1750, causing some sort of autoimmune response. We have the idea of, the dust, the chemicals, the plastics. There was a very interesting study done in Australia on dust from strip mining, and the amount of dust that kicked up into the air. And when they started these massive strip minings, these dust clouds would arise, and there was a direct correlation in the local surrounding towns of childhood asthma, being as a direct result of the dust. So chemicals and plastics, pesticides on the foods, cell phones. So that's an interesting idea, the idea of electromagnetic interference in some way, creating some sort of autoimmune response. We have molds and preservatives. So a lot of these are modern introductions. Continuous exposure to the challenges. The continuous exposure challenges the body's balance, the body's ability to differentiate what is harmful and what is not. So, Terry, what would you think is the most common area for stimulating allergies that you see in your practice? What are the most common culprits?
The common culprit, well, it could be any of those. A lot of people have pet allergies, as simple as pet allergies. Those are the primary things that I think pretty much a lot of people come in for, thinking that, that's the primary thing. But it's really, there's so many other things that they're just aware of that because of their awareness of other things, like saying, it must be cat, dog. But it could be dust. It could be as simple as, I see a lot of patients who are allergic to the radiation. They have no idea of the lighting, fluorescent lighting, or computers, the radiation that comes from the computers as well as cell phones. It's not said much in society that there's a problem, but I can tell you that there is.
No, I mean, I remember I was actually on a radio show once, and somebody called in who was, called in. They were talking to their husband who was on the phone because they had such electromagnetic sensitivity that they couldn't get near any device, even the telephone.
Right.
So there are a segment of people out there that are extremely allergic to that.
And you're thinking about also children who are constantly exposed to cell phones, to TV, computer monitors, things like that, and their immunity is so innocent at this point. There's not a buildup of strength. Is that it's so easy to break down the immune system. Right. And so you're going to see that with children and adults as well.
So there are two components here, though, aren't there? There's one that is the external kind of pathogen, the irritant, and then secondly, it's the reactivity of the body that we'll talk about later. Right. But you would say that you place equal importance on both, or you work more with reactivity, lessening reactivity?
It's an undermining. So it's a constant. A lot of people think of it as constant. There's not a lot of flare-ups. It's just people with eczema. It's just like, where was that coming from? There's also asthma that's prevalent. But in the end, it comes back to, even the foods that they're eating. And it doesn't even have to be something like major, like radiation. It can be as simple as the foods that they're not absorbing. Like Dr. Gertlet was saying that these things that you're exposed to, they undermine the gut. And so by undermining the gut, the patients are not getting the proper nutrients in order to have that energy that they need. And so therefore it breaks down the immune system and say, well, gee, I don't know why I'm so tired. Right. I don't know I have this. I don't know I have...
The secondary effects.
Secondary effects. On, yeah. And you don't realize it could be asthma, but it could be as simple as difficulty digesting. Yeah.
So before we kind of cover some of our kind of innovative, integrative approaches, if we could go to our next slide, this covers the idea of what is the Western approach to allergy testing, the RAS test, and Dr. Gertlet, could you explain a little bit about the RAS and the skin prick test? And we've got an example of the skin prick test there on that guy's back.
Yeah, the RAS and the skin prick test, without going into too much detail, depend on a certain level of antibody, a class of antibody that they're testing, which is not the class that we depend on for the chronic, what they call delayed hypersensitivity to food allergies. This is really the acute allergies, like somebody goes into shock when they eat an allergic food and they get hives. Asthma can be harassed. So this is a different level of antibody. We don't test these, but these are certainly valid for the acute.
Yeah. And the skin prick test, where you actually prick the skin with an allergy.
Yeah, that also...
And you measure the reaction, right?
Right. That is partly related to the delayed hypersensitivity. But I must say that these tests do not correlate well at all with food allergies.
They don't. So these are more for like external allergens.
This is really more for hay fever, respiratory allergies specifically.
Yeah. And even, this idea of the correlation to the mind, too, how reactive we are, how stressed we are, how compromised, let's say by stress that we are. I remember there was one study, it was very fascinating to me, where they had somebody with multiple personality. And one personality they knew was allergic to orange juice, and one wasn't. So they had the personality, when it came through and was present, allergic to orange juice. They would drink the orange juice. Immediately they would come out in hives. And then halfway through, the other personality came in, and their hives disappeared. And it was almost like there was one captain of the ship that had the history, had the historical event that primed it for the allergy, and one that hadn't. And it even went down to, which is fascinating, the IgEs and the IgGs, the reaction in the bloodstream. And I forget which is the long-term one, the IgEs or the IgGs.
IgG is
so the IgG is long-term. So even the one that should have been present for months after had cleaned out when the non-allergic personality had taken over. So there's a lot of unknown factors clearly going on, but there's a big interplay on how our personalities are reactive to certain historical events, which we'll talk about. I imagine link into the NATE testing with the muscle testing. So some of the if we could go to our next slide, some of the alternative approaches, of integrative medicine with acupuncture and with herbs, use a very different, more holistic. Would you like to describe this one?
Sure. The testing that we can do is through acupuncture's pulse and tongue diagnosis. Pulse is, from an acupuncture point of view, the acupuncturist tests to see if there's a particular meridian or channel.
What does that look like? Maybe you could just show on Arthur.
Oh,
Dr.
right.
Gertlet,
Okay.
take his pulse.
So typically there's 3 pulse points. This being the lung, the spleen, and triple warmer.
So it's just a way of kind of monitoring 12 major energy systems in the body.
Exactly. Right? Each position represents
what do you look for
something.
allergies on a pulse like that?
Looking for not so much like, oh wow, he's allergic to milk. It's basically we're looking for a deficiency, deficiency or an excess.
Yeah.
And acupuncture is a different language compared to Western medicine, and so we would want to balance a particular pattern and bring it back into harmony, as opposed to saying, well, we're going to treat your something specific and you'll be
it's
done.
not treating the disease or the specific allergen. It's rather about how to balance the whole body as a whole and take it out of a reactivity.
Right. Yeah. The idea is to build up the immune system, to put it back in balance and say, okay, well, I can take care of myself when I'm exposed to this particular item, as opposed to, just being overwhelmed and can't do anything. So that would be the pulse,
and
the
then
diagnosis.
There's also tongue.
And then there's
another
tongue.
Classic traditional Chinese diagnosis.
So we have a patient to stick out their tongue and to see.
We won't bother to do that for you.
and the particular coding and the color indicates something to us that kind of reinforces the idea of what we've diagnosed into the pulse.
Yeah.
Confirms that piece.
So the more modern piece that you use, for instance, we'll talk at the end more about NATE, would be muscle testing.
Muscle testing.
Which is not classic Chinese, which has been wrapped up in NATE. Maybe actually now's the time to just describe a little bit about NATE and how that works in your practice in the treatment of allergies at the Darcy Wellness Clinic.
Yeah. So muscle testing is a form of kinesiology, and basically we use one muscle to indicate if it's weak or strong. The weak is typically the body's immune system.
So how would you do that? Maybe you could just demonstrate quickly on Dr. Gertler.
So I'll have Dr. Gertler extend his arm and basically try to resist. So I'm going down and you're going up. Okay. So I'll say, show me a yes. Try to resist. Show me a yes and show me a no. No. Show me a yes. And show me no. There we go. Okay. So basically, it's a little bit, when you're on the table, it's a little bit more accurate.
So if you said something that the body would receive as being very negative, you could perceive that by how much resistance there would be in the muscle.
Right.
Whereas if it was positive, the response would be different.
Right.
Yeah. So you use that as a kind of an insight.
A guide. Right.
Yeah.
So with NATE, the idea of NATE is that the body is like a computer system. And the idea is that the body has a faulty program, and so when the person sees something as an allergy, it's going to be reactive. That's the program. NATE comes in, and we find the particular item that they're allergic to, whether it be milk or dust or pollen or anything like that. We muscle test to see if it's weak or strong. The weak will indicate to me whether the person's allergic or not. The strong will be that they're strong and they have no problem with it. The weak will be that they have an allergy.
So you kind of process through a number of different irritants by using the muscle testing as an insight.
We check.
You combine that with classical Chinese medicine because I practice something a little different in terms of, acupuncture and herbal medicine within the classic sense, and that can treat acupuncture quite well. But what Nate has done is also brought in this other technology.
Right. Nate has incorporated the acupuncture piece. You do the pulse points and things like that. You do acupuncture points. So once we find the particular thing that the person's allergic to, it incorporates like the idea of the acupuncture points that we would use along the spine in order to correct that program. Once we correct that program along the spine, we turn the patient over, and then we use acupuncture needles.
So it's a different, more kind of specialized protocol, adding in some newer things to classical Chinese medicine.
Absolutely.
For the specific treatment of allergies.
Right.
So, Leslie, one of the issues with, say gluten or, other kind of dietary allergic responses is the rotation diet. Could you, as a nutritionist at the Darcy Wellness Clinic, could you tell us a little bit about how you approach allergies?
Sure. If a person tends to be intolerant of foods, and there's some confusion among people, the difference between an allergy and intolerance, and there's some people follow different definitions, but if we're looking at a potential allergy or intolerance, you want to rotate the 5 key allergy. First of all, you'd preferably eliminate them from the diet for, say, 10 days. And then what you want to do is
So what would that look like? If you thought you were gluten intolerant, what would that look like?
You would eliminate everything that has gluten in it, and those are typically all your wheat
products. Give us some examples.
Any kind of cracker that has wheat, that's made out of a wheat product, rye, oats, or barley. And there's some controversy over whether rye should be included, but for purposes of diagnostic.
So crackers, what other foods would that be?
Bread, pancakes, waffles, muffins, anything.
And what kind of symptoms would you have with gluten intolerance?
You could have any kind. You could have gastrointestinal symptoms. You could even get eczema. You can get brain fog, many different types of symptoms.
So when you start to work like this, some symptoms will improve.
Absolutely.
When you
eliminate
that
if you're
allergen.
intolerant of a gluten.
Or intelligently intolerant. So the idea then, you have the gluten intolerance, you start to do the elimination. How does the rotation diet
Well, let's say you do, if with a rotation diet, if you're intolerant of 4 or 5 different food items, you want to, and that's been identified, you don't want to expose your body to that food group more than once every 4 days. So, for example, if you're allergic to dairy, let's just say you're intolerant of dairy products, you can tolerate some. You may want to have something on Monday, but not have a dairy product, any kind of dairy product, until the next Friday or Saturday. So you're giving your body a break.
Why not just stop it completely?
And that's another alternative, is just stop it completely.
But so is there an idea that you can desensitize the body to that particular allergen so you can slowly reintroduce it?
You can, but I think people who have a tendency towards allergies and intolerances always have to manage those foods that they might be intolerant of.
Right.
It's just almost a lifestyle change that has to happen.
And any other major, allergies that you've worked with?
I think the food intolerance, and then you've got the chemical allergies and the seasonal allergies. Right. But most of the allergies are related to the proteins that are located in the food. So they're often protein-based.
And what would that look like if somebody wanted to come to the Darcy Wellness Clinic and work with you? How would that look like? Would that be once a week for a while? Would it be once every 2 weeks?
Initially, it'd probably be once a week, and then it can gradually extend out from there. But I typically like the client to keep a food awareness chart, mapping not calories or protein or whatever, but actually reactions, and it could be anything from a gastrointestinal reaction, a mood reaction, or a fatigue type of thing. Right. And they keep track of that for a week to 10 days. We reevaluate that, and then usually pinpoints where food intolerances are, and we move from there.
And Terry is an acupuncturist at the Darcy Wellness Clinic. When you use this specialized Nate, could you tell us what that looks like? Somebody comes to see you. How does that work?
Typically, I see a patient at least for 10 treatments.
Yeah.
We need to clean out the...
So these are acupuncture treatments. Each one includes balancing the energy and then doing the specialized Nate work?
Right. It includes an acupuncture treatment. Yeah. But for children, it doesn't have to be. It would be just massaging or stimulating those particular acupuncture points.
So it's not necessarily... So for childhood allergies, you would just do massage or Or like actually I see
Yep.
you're wearing, you can put magnets on
Yes.
certain acupuncture
Yep.
points.
You can do magnets or
Yeah.
massaging those
So it
particular
doesn't
areas.
have to be needles for kids.
Nope.
There are alternatives.
There are definitely alternatives.
So once a week for...
It can be once a week.
Yeah.
It can be from once a week to 3 times a week, depending
Yeah.
on how fast they want to go through the process.
And there's certain protocols
Yep.
that you have to work through.
Yep. In order to go through the process, you need to treat one particular item each treatment. Based on the protocol, it's 10 treatments first. You
Yeah.
want to do the basics of egg, calcium, vitamin C, vitamin B. These are all things that are part of your immune system that we eat foods on a daily basis. We don't realize. So we need to make sure that we clean that out, make sure that they're not allergic to these things so they can build up their immune system. So making sure vitamin B is important for children with ADD or autism because it serves the cognitive piece. So if a child is not absorbing vitamin B, they're going to have cognitive issues. So we want to make sure that's balanced and cleared out in order to proceed on to the next thing that when they're the major thing that they're really allergic
progressive
to.
protocol.
Progressive protocol. So I would say at least 10 treatments.
Yeah.
But then after the 10th treatment, then we explore the idea of what they're actually allergic to. And then we treat those on an individual basis. Cat, dog, pollen, grass, trees. If it's environmental, of course, if it's foods, it would be, my preference would be enzymes, grains, glutens, wheats, milks, anything of that nature that a lot of people are constantly exposed to.
So you would have them, while you're treating, progressively stop certain
Yep, I have
allergens.
them avoid it for 25 hours after the treatment. It's only some people say, oh, it's only a day. And it's just a day. And after that day, after I muscle test and see how they're going, they can be no longer allergic to that particular item. I've been a patient myself, and I've never had to retreat my
so tell us a little bit about
treatments.
that, because it was quite dramatic.
Yes.
Yeah.
I was actually exposed to formaldehyde when I was dissecting a pig in college, and it set me off to be allergic to everything. I thought it was a cold that just never went away, and over time it developed into asthma to the point where I was having asthma attacks every 2-3 hours, even with medication. And I went from doctor to doctor. I even did alternative treatments, and there was really nothing that made a difference. I found somebody who found a doctor who said, well, why don't you try a NATE process? And it can't hurt you, can only help you. And so I reluctantly went to see a NATE practitioner. And I'd say after the 10th treatment, I noticed a change.
Yeah.
It was a slow change, but enough to encourage me to try other things.
So slowly you pulled out and you got great results from that
Absolutely.
technique. That's what drew you into practicing
Yep.
it now. That's a great story. And Dr. Gertlet, just to conclude, we've got 1 minute left. You use supplements in your practice, but how would you approach severe allergies in your practice, just quickly?
Well, very quickly, test them for food allergies with a blood test,
Yeah.
and either eliminate or rotate them, send them to Terry to help with the diet, and that makes a big. There are many other stuff: fish oil, CoQ10, vitamin D, vitamin A.
So there are a lot of dietary supplements that can also help alongside NATE, alongside acupuncture, herbs, and nutrition. So there is a lot of hope out there for people who don't know about these options to try them and get the good results like Terry did. So Terry Plant, pharmacist, acupuncturist, and NATE practitioner at the Darcy Wellness Clinic, thank you very much. Dr. Gertler, medical doctor extraordinaire at the Darcy Wellness Clinic, thank you very much. Leslie Barnett, certified nutritionist at the Darcy Wellness Clinic, thank you very much. And we hope you enjoyed our program on allergies and the integrative approach and giving you new options to treat allergies. My name is Geoff Darcy, acupuncturist and herbalist, and thank you very much for joining us.